so much for inviting me to come and speak with the group today. I've really enjoyed getting to hear the presentations and the conversations that I have had a chance to hear over the last couple of days and engage with some of you. I'll admit that it got so many other things going in my mind that even though I arrived yesterday in Missouri with a plan for what I was going to share, just the conversations that I've been a part of have it kind of reminded me, oh, I think that the group might be interested in this, and I think the group might be interested in this. So I've added a bunch of things, and so I might be going all over the place. I'm going to try and stay coherent, but I'm just hoping to offer you some of the resources and information that we've either generated through funding or have looked to, maybe haven't funded, but have looked to help inform the work that I do. So I should say that while my professional training was in community and developmental psychology, and that's obviously important to how I approach the questions that I'm thinking about, my life experience equally informs it, if not more, which is as the daughter of immigrants who benefited from public assistance programs as a child. In particular, my parents, I know, participated in WIC during the program's first year as a federal program, and we participated in a free lunch and summer program offered by the city where we lived, as well as other services and programs that were offered by community-based and faith-based organizations where I was growing up in Newark, New Jersey. And that network of organizations as well as government assistance, I think really was critical in helping my family feel welcome and supported. And so I was drawn to evaluation research and to child development with a desire to really think about how we can improve the programs, what we need to know about the needs of families, of low-income and vulnerable children and families and immigrant families, and how we can improve services. So all of that really informs my perspective. I should say that any views or opinions that are expressed are my responsibility solely and not those of the federal government or the agency that I work for. That's clear, everybody, right? Okay. So where am I coming from? Corinne did the honors of giving you kind of all the organizational titles. I feel like I should offer a bit of an overview. Wait, okay. So the Administration for Children and Families within the Department of Health and Human Services is responsible for federal programs that are intended to promote the economic and social well-being of low-income and vulnerable children and families, individuals, and communities. ACF programs fund a variety of services, including Native American language preservation, refugee resettlement, and childcare, as well as many others. So this is an organizational chart, which sometimes for visual learners is helpful, just to give you a sense of just how many different program offices we're talking about, as well as, and OPRE is in there, that's the office that I'm in. So within ACF, the Office of Planning, Research, and Evaluation is charged with advising the Assistant Secretary for Children and Families and partners in the program offices on how to increase the effectiveness of ACF's programs in serving children and families. So we do this primarily through conducting evaluations of existing programs, also synthesizing research and evidence on specific topics that are related to the program's objectives, completing descriptive and exploratory studies, and this is primarily through contracts, grants, and cooperative agreements. And in addition to providing data and research evidence to inform programming, we try to provide guidance to our program partners on research and evaluation methods, on administrative data, and on performance measurement. So as a whole, the office works to try and improve the quality, usefulness, sharing, and analysis of data and research on ACF programs. I did it again. So when people think about using research to inform policy, most people tend to think about legislation. And this might be obvious to everybody, but I just want to just highlight this aspect of the kind of the bridge between research and policy and where I sit. So forgive me if this is all obvious, but whereby Congress authorizes funding and provides broad requirements for a program. So one example that you might think of is the Affordable Care Act, right? The Affordable Care Act established federally funded healthcare and home visiting programs by designating specific funds, right? And defining some parameters. The public tends to think less about how the legislation is actually operationalized by people who are responsible for actually interpreting and implementing the programs. So this happens within federal agencies. And so the legislative initiatives that you're more likely to hear about are, in the news are what we consider like the big P policy. And then the small p policy gets a lot less attention in the press, but this is what happens in federal agencies like ACF and what OPRE tries to inform with the research that we support and synthesize and translate. So to translate legislation into programs that address the objectives defined by Congress, federal agencies have to use the best available information, just like everybody else who's trying to serve the public. So from the best available information from research, practice, historical knowledge, and experience. And so I'm the nerd at the table who tries to bring numbers into the conversation and research evidence. So federal agencies are implementing legislated programs by defining standards and requirements for programs. And usually this is a very extensive process with engagement from a lot of stakeholders. Sometimes there are specific requirements in legislation, but more often, for most issues, the language in the legislation is actually vague, and agencies must determine the best ways to try to achieve the goals of the program that's been defined by Congress and funded by Congress. So there's some immediate questions that we have to answer for program implementation, and we try to bring whatever research and evidence is available to inform those questions, but then there are many long-term questions. There are just as often questions that we know are going to take time, are going to take many years of research, kind of building a research portfolio and trying to kind of advance in the field to try and answer. So I just want to highlight this as important context for understanding where I sit and how I kind of try to support and communicate research that informs policy questions at this level. I hope that wasn't too boring. Okay, so some of the overarching questions at the highest level in general that OPRE is trying to address to inform ACF programs are these. How can programs better serve children and families? Are programs reaching the children and families who need the assistance? But to address these, there's obviously a lot of other questions. So this is like the highest level. When we're thinking about, so programs are established and administered with broader objectives and intended outcomes in mind, and we're thinking about these larger questions. However, over time, ACF has recognized that in order to really support low-income and vulnerable children, families, individuals, and communities, as the programs are intended to, we really do need to look at subgroups or subpopulations. So within the population that ACF is focused on, we ask ourselves constantly, are we reaching and serving eligible children and families equitably? Does serving all groups effectively require tailoring services? How do we tailor program approaches to meet the needs of diverse families? How can services be more culturally responsive and competent? And how do we identify disparities in human services? These are really big questions that they're not easy to answer. And then when you think about it in terms of the very specific programs, it opens up a whole other set of questions. So more specifically, I'm going to share some of the groups that, some of the subpopulations that over the years that I've been in the federal government, and before I joined the federal government, I've been thinking about are Hispanic children and families, dual language learners or multilingual families, immigrant families, and families employed in migrant and or seasonal industries. So I'm going to be sharing some data, some information, and some resources related to these groups with you today. Okay, so again, I'm going to say something that's probably really obvious. The Hispanic population is diverse, right? That isn't obvious to everybody, right? So I've felt like a part of my work, a big part of my work, has been making that clearer and helping the conversations really incorporate more of an awareness of the diversity within Hispanic populations. You know, most of the nationally representative data that we have to rely on to think about national programs at the federal level doesn't really allow us to examine the diversity of needs and experiences within the Hispanic population, and much less so about the Hispanic immigrant population and experiences, or mixed status families. So we look at this diverse population, and I've been trying to look at unpacking the experiences and the needs as if through a prism, right? So whereby each question and study helps us to understand kind of a different angle, right? Or a slightly different but overlapping subgroup, right? And so hopefully, I'd like to think, and I hope that this has been helping to give us a clearer picture of the families that and children we're trying to serve. So some of the common concerns and questions that are, you know, even though most of the work that I do is focused on early childhood programs, you know, the families are largely the same. They differ in some ways. You know, if they're receiving child care subsidies versus cash assistance, you know, they might differ in certain ways. But all of these programs, what I've heard are some very common concerns and questions. And so we've tried through a number of projects, including the National Research Center on Hispanic Children and Families, which I'm going to be sharing some work from, have really tried to offer research to inform some of these questions. So some of the common concerns and questions are around evidence base for intervention strategies that maximally engage Hispanic children and families. You know, what really works? I constantly hear, you know, what do low-income Hispanic families really need to effectively support their social and economic well-being? Is it the same as African American families in, you know, in the Southeast? So there are some very specific questions around what kinds of strategies actually are effective. Some programs recognize that there may actually be barriers to programs and services that Hispanic families face, but it's not entirely clear to them what they are. Often, over the years, I've heard people attribute why we don't see higher rates of participation among Hispanics in certain programs as cultural preferences. But have we really examined that? And so those are some of the questions that I've been trying to address. There's also a whole area and thinking around family or household level processes that we haven't adequately identified and let alone measured properly with respect to Hispanic families. And so what are the implications, for example, of family or household structure or the complexity of households on well-being and on the participation of a Hispanic family, a Hispanic-led family in ACF's programs. And finally, you know, there's a whole set of questions around reliable tools for assessing needs and outcomes. So what's reliable and accurate, the most reliable and accurate measurement for assessing well-being among Hispanics? So when am I going to show you some data? I'm going to talk about some national data right now. This is, you know, a lot of what I've been trying to do over the last couple of years with the National Research Center on Hispanic Children and Families, and before we established that center, was just trying to see what the national data might offer us in terms of better understanding what the needs and experiences are. So a really key finding for us is that, this isn't new to you, I'm sure, that 2/3 of Hispanic children in the US live in or near poverty. So that's that far pie remnant over there. More recently, though, to look at this question of child poverty from a different angle, considering all children living in poverty in the US, I'd want to alert you to a report that's recently been released, and the next two slides are going to be presenting data and insights from. It's a consensus study report from the National Academy of Sciences called Roadmap for Reducing Child Poverty. So the white bars here represent the share of all children in the US comprised of children from specific racial and ethnic groups. And the shaded bars represent the share of a poverty category. So poor children are defined as below 100% of a supplemental poverty measure. Deeply poor children are in families that have incomes below half of the supplemental poverty measure. And finally, the kind of textured bar is the share of children living in persistently poor counties. So focusing on Hispanic children, which is the lowest set, the bottom set of bars, the white bar represents what many of you are aware of already, that 1 out of 4 children in the US is Hispanic. The gray bar, actually right underneath the white bar, shows that 41% of poor children are Hispanic. So that means of all children who live in poor households in the United States, 41% of all children are Hispanic. I'm not going to repeat that again, but hopefully you got that. The darker gray shows us that 34% of all deeply poor children in the US are Hispanic. And then the textured bar shows that 30% of children living in persistently poor counties in the US are Hispanic. So I want to also highlight that the National Academy's report and estimates actually use the supplemental poverty measure, which many of you might be aware of, but it actually measures poverty based on a much more realistic picture of families' resources for everyday necessities than the standard federal poverty measure. So I'm going to just say it one more time. The largest share of poor children in the US are Hispanic. This is significant. Further, thinking about child poverty by citizenship status of children and of adults in a household, the Academy estimated also what the relationship is. And the relationship between poverty, citizenship, and immigration status in the US is strong. I don't need to tell you that, but it's nice when the National Academy's committee kind of emphasizes that. So children living in households where all members are citizens, that's the top, we're looking at the top bar, but it's the dark bars in each of these sets. But looking at the top one, so children living in households where all members are citizens have a poverty rate of 10.2%. In contrast, children living in households with non-citizens, and particularly unauthorized immigrants, are 3 times more likely to be poor. This is true for children, even for children who are US citizens. So one of the analyses that the National Research Center for Hispanic Children and Families wanted to do, because of just how strong the relationship is between immigration status and experiences and poverty, is to better understand and estimate how many Hispanic children might be in this situation. So even though an overwhelming majority, 94% of Hispanic children are born in the United States, half of Hispanic children have at least one parent who was born in another country. And these estimates, drawing on publicly available data from several data sources and applying different approaches, right, to test the sensitivity of the estimates, a young scholar, actually it was a doctoral student who was a fellow at the National Research Center on Hispanic Children and Families, estimated that about 1/4, so 25 to 28% of all Hispanic children in the US have an unauthorized immigrant parent. Research suggests, and many of you may all be aware, that the challenges associated with having an unauthorized immigrant parent are linked to a variety of adverse experiences, primarily caused by poverty. In addition, this means that there are more than 4 million Latino children in the US who are at risk of experiencing parental separation and the stress and fear that's associated with their family's uncertain legal status or of other members in their household. This is very important for us to think about as we try to support and provide guidance to the programs that we work with. There's a lot more information that I'm not going to share, a lot of tables that are available publicly from the National Research Center. But two things that I just wanted to highlight was that for most Hispanic children in the lowest income households, income stability, so that's fluctuations, like either negative or positive shocks in income on a monthly basis, is stable. So even though they are poor and there's low income, there's actual income stability. And this is important, actually, having some level of stability, even if it's very low income. People are, there's lots of different things that contribute to a family and household's ability to really weather any shocks, but the fact that they are experiencing fewer shocks from month to month than other low-income families is an advantage, right? It's a silver lining. The exception to this, though, are households with adults households who are linguistically isolated. So this means a household where no person over the age of 14 speaks English well. So those are particular to, for me, and maybe for you, it suggests that these are households that you may want to pay particular attention to if they're linguistically isolated, because it is more difficult. There is more income instability. So despite the high levels of economic need, Hispanic families participate in public assistance programs, many public assistance programs, at lower rates than other racial or ethnic minority groups. So using national data, the scholars at the National Research Center examined the reasons why low to middle income Hispanic parents reported they were not applying or using public assistance, or for those who were already receiving assistance, not applying for additional forms of assistance. This analysis focused on parents in the bottom 3 quintiles of the early of earned family income. So roughly, they focused on the population that was most likely to be eligible for public assistance programs. And not knowing about available assistance was another common reason that low to middle income parents did not apply. The most common, sorry, I skipped something. So the most common reason for all groups was saying they didn't need any. They reported that they didn't need any assistance. But many also reported that a reason for not using public assistance or applying for it was that they didn't know that it was possible. However, you'll see in the bars all the way to the right that low-income Hispanic parents are much more likely than their non-Hispanic peers to report immigration-related concerns as a reason for not applying for assistance. So 15% of Hispanics, 1 in 5 Hispanic parents, perceive that they are ineligible due to immigration status. So the scholars at the center, since this issue is most relevant for immigrants, the authors looked more closely at Hispanic immigrants who potentially have different reasons for not applying for assistance than native-born Hispanic parents. And the authors examined the perceived ineligibility due to immigration status among foreign-born Hispanic parents across 3 immigration status categories: naturalized citizens, non-citizen legal permanent residents, and other foreign-born. And other foreign-born is probably where you are most likely to find unauthorized or undocumented parents. So the federal eligibility guidelines do have restrictions regarding residency status and duration of time in the US. But immigrant status alone does not necessarily bar access to public assistance, and U.S.-born citizen children of immigrants face no immigration-related eligibility restrictions. So yet, even though that's true, even among those who report naturalized citizenship, there is the perception that they are ineligible. It's understandable. There's a web of policies and eligibility criteria that can be, I can't keep track of all of them, so it's very difficult to keep track of. 9% of naturalized citizens and 36%, so a third of legal permanent Hispanic parents who are legal permanent residents reported that they thought they were ineligible due to immigration status. So the results really suggest that many Hispanic immigrant parents may have misconceptions about eligibility for public assistance. This might be obvious to you guys, and this is something that I know a lot of smaller studies or locally focused studies have found, but to actually be able to see this and try and unpack it at the national level with nationally representative data is very important for helping to inform policies and how things are being actually implemented. So this is, I should have asked, this might be of interest, more interest to researchers and kind of data nerds like myself who are in the room. There's limitations of the available data. Clearly the grouping Hispanic makes it challenging for us to really observe important social experiences that are important for understanding the needs and service experiences and the outcomes of interest to us, right? So over the course of a few years, ACF convened an interdisciplinary group of experts on Hispanic populations to discuss the questions, a lot of the questions that I mentioned earlier. And this group of 20-plus experts in public health, economics, child development, anti-poverty programs, youth and adults, and young adults, child welfare, they told us emphatically that existing federal surveys do not consistently collect the data that would allow them to actually examine and understand how Hispanic ethnicity actually interacts with sociocultural experiences, right? Or how it relates to the outcomes that we're interested in. So because current survey measurement is really inadequate to really differentiate the characteristics within the Hispanic population and unpack the experiences that are important to understand, we, over the course of a few years, worked with the group to identify 10. We were looking for a very small number, defining just a small number of survey data elements, with the hopes that having a small set would encourage researchers and federal agencies to actually add them to surveys. So we identified 10 additional data elements that will improve, that the group, this interdisciplinary group, really believed would improve our understanding of the diversity within Hispanic populations in the U.S. if we include them alongside other demographic items that are important for whatever the objectives of a particular study are, and that are typically collected in federal research surveys. So this is something that I've been trying to work on for many years and trying to encourage and make people aware of. And the aim with this 10 set of items is to really try to support not only ACF's research, but encourage other federal agencies and researchers in the field who are doing survey data collections to really examine this set of characteristics to improve our understanding of the diversity of Hispanics and the diversity of their needs and their experiences with our programs. So if we continually, move on. So this then is the National Research Center actually looked at and developed an interactive data tool that allows you to see which of the recommended data elements are available in national and large-scale data. So these are all publicly available data sets, and you can actually see each of the recommended survey items separately, whether it's included in a data set and how, and then precisely what the question asks. So in this case, by pointing my pointer at that data set, which I can't read, I don't know if you can. Okay, the ECLSB, the Early Childhood Longitudinal Study Birth Cohort, I believe. You can see that in terms of country of birth, the way that it's asked of parents, parent respondents, is in what country were you born, and then how responses were recorded. So again, for people who are looking for data sets that have substantial subsamples of Hispanics, and you have certain outcomes in mind, and you know what the research, what the literature or theoretical frameworks tell you are important to consider, this might be a tool, a handy tool to help kind of zero in on a couple of data sets that you can work with. So now that's looking at a whole lot of different national data and how that informs federal research. But now looking specifically at ACF programs and data on ACF programs, I'm going to look at data from two programs in particular that are most of the work that, most of what I work on. Head Start programs. How many of you are familiar with Head Start? Okay, all right. So then I'm not going to explain what it is. But Head Start, something I want to highlight is that it's a federal to local agency grant. So it's a federal grant made to local agencies. Local agencies have some flexibility. There's program performance standards, a lot of them. But there's also some flexibility for local agencies to design services to support the comprehensive development of children and family well-being. In 2017, Head Start programs served over 1 million children, age birth to 5 and pregnant women, through centers. So they serve them in centers, also family homes and in family child care homes, in urban, suburban, and rural communities. The Child Care Development Fund is intended to improve access for low. How many of you are familiar with the Child Care Development Fund? Much less. Okay. So the Child Care Development Fund is funding to states from the federal government that's intended to improve access for low-income working families to affordable, high-quality early care and after-school programs. So families with children up to the age of 13 are actually eligible and are the target of the program. And it's administered through a block grant to states, territories, and tribal governments to help families pay for childcare that fits their needs. And it also has a set aside of funds that are intended to improve the quality of childcare for all children in the state, not just low-income children, but all children in the state, with the idea that we need to improve access overall to high-quality childcare, and that that will also hopefully help low-income families be able to access higher quality care. So CCDF is the primary federal funding source for child care subsidies, and in 2017, close to 800,000 families received child care subsidies from CCDF every month. That's 800,000 families, but there's a lot more children who are actually being served. So looking at Head Start in particular, since so many of you are familiar with Head Start, maybe I don't need to say much about this because you already know, but this data is coming from the FACES survey, which is a publicly available data set that you can look at, because there's lots of questions that we haven't been able to ask because we don't have the time and resources to answer all the questions that are important to address. But it is a nationally representative study of the 3- and 4-year-old children who are enrolled in Head Start programs. And 42% of parents who have children enrolled in the program reported that their child was Hispanic. So this is roughly equivalent to what we saw earlier about the share of poor children in the U.S. who are Hispanic. This is comparable. So since I look at early childhood, early literacy and language use and language development is obviously a really important area for us to consider. So we do collect a lot of information about language use not just from families about the languages used at home, but also how language is being used in programs. If you're familiar with Head Start, then you may also be familiar with the fact that Head Start has several program requirements that really require programs to have staff that can speak, staff and support in classrooms that can really engage with families in their languages, their primary languages, and also support children who are hearing multiple languages at home. The assumption is not that all children are English dominant or that they are coming into the program understanding any English at all. So it's important, and there are program requirements around the staff and the organizations really getting to know what the language environments and experiences are of children at home. So here, just from 2014 data, we see that more than 1/3 of children entering Head Start in 2014 came from households where a language other than English was spoken. And among this group, Spanish was the primary home language, but it's not the only home language, other language. So among the 39% of children in Head Start who live in homes where a language other than English is spoken, 88.5% are in homes where language is spoken, and about 12% are in homes where other languages are spoken. So in terms of the primary language that's spoken to a child at home, 24% of all Head Start children are primarily spoken to in a language other than English at home. And among this group, within this group of children who are dual language learners or multilingual, 89% are primarily being spoken to in Spanish at home. So although by the definition used here in this survey, parents of DLLs, or at least in the analyses, parents of dual language learners speak to their children primarily in a language other than English, there is actually variation in the language that they might use to read to their children. So parents were actually asked in different kinds of activities, what language do you use primarily with your child? And about half of all dual language learners in Head Start are being read to by parents in a language other than English. So 46% of them. 28% are actually being read to in both English and another language. And 26% are among this group of children who are hearing other languages at home. When their parents read to them, their parents report that they are reading to them in English only. So these are important pieces of information which may be obvious, but the actual breakdown is not obvious to us, and it's important so that the staff can understand how to support families and children, because it is a dual generation program, Head Start. It's about also supporting parents to really be the primary educators of their children. So thinking about household composition, the majority of dual language learners served by Head Start live with both of their biological or adoptive parents. And dual language learners are more likely to live with both parents than are non-dual language learners, so 71% versus 39%. And among dual language learners, 27% live with their biological or adoptive mothers only, and not their biological or adoptive father, although other adults may be in the household. This is important because, historically, some anti-poverty programs haven't necessarily thought about both parents, and really worked through engaging both parents. But looking at this group in particular in Head Start and in national data really does inform us that staff have to be thinking about engaging both parents and other family members even, and not just kind of designing programs or services or opportunities in terms of assuming that the mothers are going to be the only person stepping foot into a program. So looking at the immigration experiences among dual language learner children, so for you might be thinking that dual language learners is kind of a proxy for immigrant families. Obviously not. They don't completely overlap, but it is sort of a proxy.
But actually looking more carefully at what the immigration experiences are, the immigration status, the majority of dual language learner children in Head Start were born in the United States, 96%, while many of their parents were not. So more than 3/4 of dual language learners are in families in which both parents were born outside of the United States. Most parents of dual language learners have been in the United States for at least 6 years, and more than 2/3 of dual language learners' parents are from Mexico, with another 13 to 14% from Central America, and the rest from South America, the Caribbean, Africa, Asia, and elsewhere. So there's data about parent education. There's data about household income that I wanted to share, but I'm realizing I'm not going to have enough time to get to everything else, so I'm going to be skipping through these. Income is not the only thing that matters, obviously, for understanding child poverty and how to try and help support children and their families. So we've also been looking at household financial strain. We asked parents in the past 12 months, did the family, so they agreed with the statement or disagreed. In the past 12 months, the family did not have enough money to afford home, or clothing, or food, or medical care, and they were asked about each of these separately. Approximately 54% of dual language learner children's parents reported that their family did not have enough money to afford at least one of these basic needs. Compared to non-DLLs, where it was 45% of them. But I think that more informative, from my perspective, is to see where they're experiencing the financial strain or hardship, and I think that can be very informative for us at the federal level and at the local level too, to understand that while they're, they might be equally likely to non-DLL families to report not having enough money to afford their home. They are more likely to report difficulty paying for clothing, food, and especially medical care that their family needed. So, as I said, CCDF, the Child Care Development Fund, helps fund child care for a monthly average of over 1 million children under the age of 13. But the use of this program in particular among Hispanic families is especially low. The U.S. Government Accountability Office actually estimates that only 20% of the population that actually receives child care subsidies in the U.S. is Hispanic, even though Hispanic children make up 35% of the eligible population. So that's well below the actual rate that is estimated to be eligible. But that's at the national level. When you look from state to state, the estimated rates of participation among eligible Hispanic children and families in the child care subsidy program funded by the Child Care Development Fund, it really varies from state to state. And in ways that are not proportional to, they just are not really proportional to the eligible population. So this isn't surprising because CCDF policies, although there's parameters and regulations at the federal level, the policies and the practices really do vary across the country. So within the federal regulations, state policies and practices can differ, right? And they do in how they actually administer subsidized childcare to low-income families. So for example, what documentation is required, right, as evidence of parental work or education activities. Also, whether applications are available in Spanish or any other language besides English. These are places where states have a lot of discretion, state territories and tribes have a lot of discretion, and it can make a difference. Some of these may make more of a difference and impose more of a burden for Hispanic families. So the author, again, a doctoral student who was a fellow at the National Research Center for Hispanic Children and Families, tried to better understand this by analyzing state-level variation in policies and practices that may actually shape the access to and utilization of child care subsidies among Hispanic families. The authors focused analysis on the 13 states
that are home to over 80% of all Hispanic children living in low-income households in the U.S. So that's Arizona, California, Colorado, Florida, Georgia, Illinois, New Jersey, New Mexico, New York, North Carolina, Pennsylvania, Texas, and Washington State. And they considered state-level variation in the following policy or kind of practice dimensions that we felt were particularly salient for Hispanic families. Eligibility requirements around whether English as a second language classes and what work hours were actually eligible for support, for childcare subsidy support. Also, the requirements, the documentation requirements for household, as evidence of household composition and work activities, the prioritization of temporary assistance for needy family recipients, and the availability of program information and or applications online in Spanish. So, not surprisingly, the 13 states that we looked at, that the authors analyzed, really do show considerable variation in state-level policies and practices. Not surprising, but it's helpful to look at kind of specifically which areas. These are just a couple of highlights, but there's more, and so I encourage you to look at the report. 7 states have requirements for minimum weekly work hours that may impose a higher burden on Hispanic families who are more likely than their peers to work informal or seasonal jobs, which we know that from national data sets that we've analyzed. So 2 of the 7 states have work hour requirements for 2-parent households that may place a higher burden on Hispanic families who are more likely to have 2 resident parents. So both parents have to actually provide documentation of work activity. And then also 7 of the 13 states have documentation requirements for household members besides the parents. There are 12 states or local entities that within states that actually make CCDF applications available online, and all of those actually request Social Security numbers on the forms for at least some of the household members. 7 of these 12 explicitly specify that Social Security number documentation is optional, but requesting Social Security numbers without explanation or without making it very clear that it's optional also imposes a burden and may concern Hispanic parents who themselves, are unauthorized or have other household members who are unauthorized. Even though that for the child, right, a child is eligible regardless of the parent's status. So almost all states except California give TANF-affiliated families priority in their distribution of CCDF funding. And so this is important to note because this may actually impose barriers to Hispanic families that are eligible. I'm not going to get into specifically why, because I want to get to some other things. And then 6 states do not provide their applications at all in Spanish. And 3 don't provide any program information in Spanish. So the authors also considered specific characteristics of the Hispanic population in states. So, for example, the proportion of the Hispanic population in these states that is foreign-born, and whether the state is a host to an emerging or newcomer Hispanic population versus a state that has an established Hispanic population. And the thinking there is that states with established Hispanic communities may be more responsive to facilitating to eligible Hispanic families. But in that analysis, we found that actually states with a lower proportion of foreign-born Hispanics, so under 25% of the population of Hispanics is foreign-born, are more likely to have policies that actually facilitate access to CCDF subsidies than states with higher proportions. So that seems surprising to us. CCDF state policies that can facilitate or limit Hispanic families' access to subsidies differ little by whether the state is home to an emerging or an established Hispanic population. So I found that also to be surprising.